We're going to continue on with the pathologies, but I wanted to go through the correct terms for the abbreviations. So make sure that you are understanding what these abbreviations are, okay? So some of the most common CRF, chronic renal failure, okay? The one that we don't see too much of is a VCUG, voiding cystourethropography. That is it's a study that is showing if there's some sort of obstruction from the bladder down to the urethra going out. So if they're having, if they're not able, if there's some sort of obstruction there. But the other one would be your EUA, your analysis. Then you've got the chronic renal, the acute renal failure, hemodialysis, benign prostate hyperplasia, know your end-stage renal disease abbreviation, INO, specific gravity, UI for urinary continence. And also, there was an abbreviation for calcium, which is C little a, and cancer was uppercase C and uppercase A. Okay, and this BUN is a blood test, not a procedure. UTI, always know that that's a urinary tract infection, okay? But make sure you just go through those abbreviations. You'll need it for the exam. So pathology, the acute, remember what your acute means, and chronic, okay? Acute is short-lived, okay? Or it's like the cold or the flu. The chronic is long-term. They don't get rid of it, okay? That's like diabetes or high blood pressure. The acute, you look at this word glomerulonephritis, okay? So the glomerular were inside the kidney in the Bowman's capsule. That's the capillaries that I said look like a ball of yarn, okay? Nephritis is nephra, is kidneys. Kidneys, also, the other term they use is reno. So anything with nephro or reno is kidney. So you know this was some sort of a kidney infection. Bacterial cystitis, we know what bacterial is. Anything with cysto has to do with the bladder, okay? So remember that the bladder, we had the cholecystitis or cholecystectomy. That was the gallbladder cystitis, okay? So when it's just cysto or cystitis, that's just the urinary bladder. Then we've got the chronic glomerular, I can't ever say that word correctly. Diabetic nephropathy. Make sure that you're not seeing it as diabetic neuropathy. Neuropathy was the nerves. Nephropathy is the kidneys, and the kidneys are getting stenosed. They're degenerating there, and it's like the neuropathy with the diabetes, and it's with the neuropathy, you've got the tingling of the feet, the lack of sensation. In the kidneys, it's going to be they're getting stenosed and they're losing their function. Diuresis is where they're urinating a lot due to some sort of medication or condition. So like if someone takes a diuretic, like to get rid of water or control their blood pressure, the one medication is called Lasix or furosemide. So this is called a diuretic when it's the pill, and they're diuresing when they're having the result of that diuretic. End-stage renal disease ESRD. Anything end stage is the final, like lung cancer can be terminal and they can be end stage lung cancer. So this is the final stage of renal failure, and they're either on dialysis and or looking for a new kidney, okay, having someone donate a kidney to them. Enuresis, N means, we've learned that EN means inside. This term doesn't make sense. Inside urine, it doesn't make sense, but this is called, it's another term for bedwetting. So they urination during sleep, enuresis. And this other word is misspelled, is gluco, G-L-U, or glyco, G-L-Y, and that's sugar in the urine. Hydronephrosis is water on the kidney. So that's where the urine is backing up from the bladder, going up the ureters, which are the tubes that go right to the kidneys. So it's backing up, and the urine is going into the kidney, and then it's swelling from the water. Interstitial cystitis is a chronic inflammation. It's mostly seen in women, and this is the lining on the inside of the bladder, and it's inflamed, and it's caused from different. It can be caused from certain liquids like acidy liquids, coffee, tea, orange juice, any of that. And it will subside, but it doesn't go away. Then you've got interstitial nephritis, and that's the lining on the inside of the nephrons of the kidney. And this impairs this. The nephrons have to do with kidney. So the filtration of it. So you've got to, it destroys that. Neurogenic bladder is caused from a stroke. It can be caused from a spinal injury, or maybe some other conditions. But this is where the bladder stops functioning. So the patient either has to straight cath themselves. That's like putting a catheter inside themselves several times a day, or have a Foley catheter inside the urethra going up to the bladder, and then they have to have it changed out every month, or a suprapubic where the catheter goes through the abdominal wall to the bladder and stays in there like the other indwelling catheter. Phimosis, this is the narrowing at the meatus, where the urethra on the penis. You've got the outside, the opening on the outside of the penis is the meatus. So the foreskin, if they were not circumcised, the foreskin grows up and it narrows at the end, and it kind of cuts down the flow of the urine. And this is usually in baby boys. So they have to be basically recircumcised. Polycystic kidney disease is a hereditary disease. These cysts are all on the kidney, and it deteriorates the kidney. Polynephritis, inflammation and infection, which is caused by bacterial growth in the renal pelvis. So pyelo, P-Y-E-L, has to do with renal pelvis. Then you've got P-Y-E, which is pie, that has to do with pus. Okay, so do not get these two mixed up. Pyelo is kidney pelvis. Renal calculus are the stones, so the other term that would be nephrolithiasis. Renal failure can be acute or chronic. It can be caused from surgery. It can be caused from medication. Sometimes the renal failure can be flipped around to acute, but then sometimes it remains chronic. Tubular necrosis, renal failure caused by acute injury to the renal tubules. So this is most frequent causes are a CVA or a myocardial infarction, which reduce the oxygen to the kidney, so the kidneys die. Uremia is the increase of urea in the blood. So you will find this with the BUN, the blood urea nitrogen, which is a blood test. Urgency is where you have to go immediately. You can't wait to find a bathroom. You got to go now. The other word was frequent, and that was if you go frequently, that's more than normal. Okay, so if you urinate twice or 3 times a morning, and you end up going like 6 times, that's frequent. If it gets to the point where you're wetting yourself, then that can be urgency. Urinary incontinence is where you have no control over holding the urine. And the other form of this is stress incontinence, and that's where people exercise and when they jump up and down or run or whatever, they leak out urine, like little drops. The other thing, sometimes they sneeze and a little bit of urine comes out. Urinary retention, that is unable to urinate. Now, your 3 terms for urination is urinate or urination, void, or micturition. Urinary tract infection is usually a bacterial, and the most common bacterial for a UTI is the E. coli. Vesicoureteral reflux, VUR. This is an abnormal flow of urine from the bladder back up to the ureter, usually found when an infant or young child is diagnosed with a UTI. So this can cause hydronephrosis also. Wilms tumor is most common in children. It's a cancer of the kidney. So your diagnostic test, you've got the 24-hour urine, which you collect your urine, and it has to be in like a dark container so that the light doesn't it can react to the urine. Bladder, your bladder ultrasound is where we use to look at if there's urine left in the bladder. After you take a Foley catheter out of a patient and they're able to urinate on their own, then you take this bladder scanner and you look over the bladder and see if there's any urine left in the bladder. The doctor will say how much he is concerned about, whether to put the catheter back in them or just let them try to go to urinate again. Blood urea nitrogen, that is the blood test that is looking at waste in the blood from if your kidneys are filtering correctly. If it's going to be high, if the kidneys are not filtering. Culture and sensitivity, that's the urine, and they use a dipstick. No, I'm sorry, let me back up. The culture and sensitivity is they take a little bit of urine and put it in a petri dish and let it grow for, I think it's like 48 hours. And then they can tell what is growing, what kind of bacteria. And then the sensitivity means what antibiotic would kill that bacteria. If it says resistant, that means that the antibiotic will not work on that bacteria. Cystoscopy, that's the scope that goes up into the bladder and the urethra, and it takes a look at the inside, and you can do biopsies, you can see tumors, you can see inflammation. So and they usually do it under sedation. The lithotripsy, the extracorporeal shock wave lithotripsy, that's for the renal calculi. They lay you down on a table, and this big old thumper breaks up these stones in your kidney, and then they want you to, when you urinate, you have to filter your urine so that you see the little stones. Hemodialysis, you've got hemodialysis, which is a kidney dialysis, or peritoneal dialysis. The hemo is where they have the fistula in the arm and they hook the machine up to your arm, and that's 4 hours a day times 3 days a week. The other one is the peritoneal, where it goes into the stomach. The patient can do it at home, can connect to their abdomen, and they can go to sleep. And when they wake up in the morning, all they have to do is disconnect, and that's the end of their dialysis. So that's a lot easier. But some people are not candidates for this because if you've had abdominal surgery, you'll have scar tissue in there, and you wouldn't be a candidate for the peritoneal dialysis. The KUB is an x-ray that they do usually lying down. They may do it standing up, but they put the x-ray is from the ribs down to past your hips so that it visualizes the kidneys, the ureters, and the bladder. So they can see if there's any stones in there or any tumors. Serum creatinine, this is a little bit more of a sophisticated blood test to check for your kidney function. And your urinalysis, that's the dipstick that they will put into the urine, and it's got these little squares on it, and it can tell you if there's blood in there, tells you what the pH of the urine is, tells you what the specific gravity is, tells you what the leukocytes are. So it can tell you if you've got an infection. It can tell you you've got too much protein in there or sugar. Urinary catheterization is where they take the catheter, the Foley catheter, and put it up the urethra into the bladder, and then they inflate a balloon to keep it from falling out. And the VCUG is the one test that they check for urination. That's the test. So this is your urinary pathology video, and you've got your quiz on Friday. So hopefully you can use this. And if you have any questions, all you have to do is give me a call or email me. Okay? Talk to you soon. Bye.